Hey everyone, Justin here at Arc Therapy again. We're going to talk about exercises to help strengthen the low back in this video. These exercises are going to be tailored to more of that flexion directional preference that we talked about last week. So if like sitting feels better than standing, these would be good for you. So all you need is just a mat or the floor to do these exercises. So I'm going to go ahead and lay down. We're going to talk about a pelvic tilt. Okay, so some of you may have done this exercise before. But what this exercise does is by tilting your pelvis, you can actually create a little bit of a flexion in your low back to help relieve pressure on the joint and the disc, whatever is causing your low back pain. So what we're going to do, and what you can do at home, is you can kind of put your hand towards your low back, and you're going to just rotate that pelvis. And what you should feel as you do that is you should feel your back push against your hand, so your back flattens, and that tells you that you're doing the exercise correctly. And you can hold this for 3 to 5 seconds, and then just gently relax. And you'll repeat this. And since this is more of a neuromuscular re-education exercise, you can do this with higher repetition. So I would do this for time, whether that's 1 to 2 minutes or 20 repetitions. So that's the first exercise. We're going to go over some progressions here now. So once you've mastered this pelvic tilt, you can challenge yourself with a pelvic tilt and a march while holding that tilt. Okay, so you'll tilt that pelvis, you'll lift your leg off the bed while holding that tilt, then you'll alternate and lift the other leg up, and then you'll relax that tilt, and that's 1 repetition. And once again, you can do that 20 repetitions, set a timer for yourself. Another good one is to hold that tilt and just gently let one leg fall to the side, and then you would alternate. And then after you've done both knees, you can relax that tilt. Okay? Once again, 20 repetitions is good there. And then the last one is called a dead bug. Okay? So there is a progression here because it is a very challenging exercise. So you would hold that tilt. And what I would suggest first is just extending those legs straight out while trying to keep that tilt. And then once you get good at that, you can lift, hold your hands up, okay, extend, while holding that tilt. And then eventually the last progression is going to be the arm overhead with the leg, arm overhead with the opposite leg. Try not to do what I just did where you move the arm, and then while holding that tilt. So that would be the hardest variation of that pelvic tilt exercise. That one I would probably start with 5 to 10 repetitions because it is going to be very challenging. Please don't forget to help us out and subscribe to our YouTube channel at Arc Therapy, or continue following us on our blog on our website. Hope these exercises help, and we'll see you soon.